Hello, welcome in to ASMR Clinic. I'm Dr. C. It's nice to meet you. I'm just going to write down a few things really quick and then we can get started. So the nurse already came in to get your blood done, correct? Okay. I wanted to go ahead and do that now so that while you are in here with me, they can go ahead and be doing the results, because we do have our person who looks at the blood here today, so that you don't actually have to wait and get a call to find out what is going on. Yes, I know you haven't been feeling good, so we just want to make sure we get everything taken care of today, so that if we need to get you on a prescription, we can go ahead and get that to you so you can go pick it up. Absolutely. So kind of tell me what's been going on. Right. Okay. And how long have you been feeling that way? About a month or so? Okay. And are you feeling fatigued? Okay. And what about brain fog? Are you just feeling like you can't think properly and confused, lightheaded? Okay. And how's your eating been? Okay. How much water would you say you are drinking every day? It can just be an estimate if it needs to be. Okay. And have you noticed your hair falling out, or are your nails feeling like they're more brittle than normal? Mm-hmm. Yes, yes. Okay. And what about your temperature? Are you feeling cold in your hands and your feet? Uh-huh. Okay, yeah. That's definitely something that is concerning, but nothing to be worried about. I just have a few things in mind that I think is causing this, so that is why I'm asking these very specific questions. Don't be alarmed. I know it's scary, but as a doctor, you have to ask these questions just to take precautions. We don't want to miss anything. Let me see here, what else? Are you feeling like you're having heart palpitations? And what I mean by that is, does your heart feel like it's beating pretty fast, even when you're not working out and not doing anything strenuous? Pretty much just like when you're sitting on the couch or when you're at work, do you feel like your heart rate is up more than normal? Okay. Yeah. Okay. And then the other question I kind of wanted to ask is, are you having any weird feelings in your throat? Like, does it feel tight? Does it feel like you're having trouble swallowing? Anything like that? Yeah? Okay. Yes, exactly. That's exactly what I mean. Uh-huh. Right. Okay. Perfect. That's exactly what I needed to know. And last question I'm going to ask, do you feel like your skin has been drier than normal? Uh-huh. Right. Okay. All right, perfect. So that gives me kind of a basis of what I can go off of, but I'm also going to be checking a few other things to really figure out what's going on here. Okay. Perfect. You're not nervous or anything, are you? Okay, good. I just wanted to ask because I know sometimes when you are nervous and you're in the doctor, it can mess with the blood pressure machine and it can also mess with your heart rate. So I just want to clarify that before I get started so that I have a general idea as to why those numbers may be off. Yes, okay. Thank you for being honest. I know being in the doctor in general is never fun and it can cause some anxiety, so I always like to check. Okay, so what I want to check first is actually your blood pressure. So, you've used one of these before, correct? Okay, good. Just wanted to make sure. So what I'm going to do is I'm going to let you choose which arm you want me to put this on. Do you have a preference? Okay. This may be a little loud, so just bear with me. Just going to put this around your arm. Going to be monitoring and making sure that your heart rate looks normal. Or not your heart rate, I'm sorry, your blood pressure. This may take a minute, so just bear with me. Right, next I am going to check your heart rate. So I'm going to be putting this on you for about a minute, and I just want you to breathe normally. This will help give me an idea of what your heart rate is at, okay? Okay. Just normal breaths. Good. You're doing good. About 20 more seconds. Okay. So with your blood pressure, it was 130 over 85, and 120 over 80 is normal, so you're right in that range, which I'm not worried about that at all. And then also your heart rate was normal, so we are good on those two. And next, since you were kind of talking about how your hands are feeling a little bit colder than normal, I'm going to just check your temperature and make sure that is good as well. Would you prefer it under your arm or under your tongue? Okay. Okay, if you can just say "ah" for me, put this right under your tongue. Okay. Temperature is normal. Good. And next I'm just going to look at your pupils and make sure they dilate correctly when I put the light in them, okay? So bring it toward your eye and just stare straight at me. Very good. Okay, other eye. Very good. Your pupils are dilating correctly. So far, everything looks good. Okay, next thing I want to check is just to make sure that I don't feel any lumps or any swelling within the throat, because you did say you were kind of feeling like it was tighter than normal, than you're used to. So I'm just gonna kind of feel around, but before I do that, I am going to put on my gloves since I will be touching you. These things can be so stubborn sometimes. So just kind of lift up your neck for me, just like that. I'm going to kind of come and feel around right under the neck. It's going to be right here is what I'm feeling, okay? This is called your thyroid gland. Okay, now what I'm going to do is I'm just going to kind of press gently around that area. Nothing too hard, just light pressing. Very good. Next thing I want to do is I'm going to feel your hands, and I'm also going to look at your nails, kind of see exactly what you're talking about here, okay? So bring out this hand for me first. They feel very cold, colder than they should. Let me look at your fingertips here. Yes, I do see some cracking in them. They do look a little bit brittle. Okay, give me your other hand. This hand is also a little cold. Just gonna check your nails. Okay, it's the same on that hand as well with your nails. And I will discuss everything with you after I finish examining everything, okay? No need to be scared. Okay. Next, I'm just gonna kind of look at your hair because you did say it's falling out. So I just gonna want to look at it and make sure that I can see what's going on here. Hair just looks kind of dry and not as healthy as it normally should. So I'm just gonna write that on here really quick. Okay. Okay, last thing I want to do is I'm just going to listen to your heart rate to make sure that it sounds normal, okay? So what I want you to do is just breathe normal for me. Good. 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 Okay, I'm going to put it on your back and I want you to do the same thing. Good. Good. Very good. Okay, now I want you to take a deep breath in and out every time I move this around, and I'll let you know when to do it, okay? So go ahead and take a deep breath in and out. Good. Again. Very good. One more time. In. Very good. And I'm going to do your back now. Same thing. In. Good. Again. Good. Last time. In. Out. Very good. Your heart did sound normal, so I have no concerns there. Make sure I got everything that I needed. Yes, okay. So now I'm just going to kind of explain to you what I think is going on, but I'm going to take my gloves off first, because these things get hot. Okay, so just by what you've told me and the symptoms that I'm hearing and what I'm actually seeing here on the chart, I think what is going on is that your thyroid is a little off. So I'm just going to kind of tell you what the thyroid is so that you understand what is going on here. So it is this little bitty organ right here that looks like a butterfly. So it goes from here all the way up your neck. And what it does is it controls your hormones, it controls all of your endocrine system. So everything about you is run through your thyroid gland. So the reason why you're feeling tired, your hair is falling out, your nails are getting brittle, you're feeling colder than normal, and you're feeling very fatigued and brain fog, and all of that is because of your thyroid gland. So this controls all of the hormones that go on in your body, and when your hormones are off, the rest of your body gets off. So that is maybe why your heart rate feels like it is beating, or your heart is beating faster than it should. Not because it actually is, but because your hormones are so off, it is just throwing your whole system off whack. So your heart's not actually beating faster, it just feels that way, okay? Yes. And sometimes I do have patients come in where their heart rate is beating that fast, but it is only because their system is just off whack. So what we do is just get them on some medication so that we can regulate it and their heart rate does go back to normal. Yes. Right. So yeah, the thyroid is a very tricky gland because, like I said, it controls so much of your body. So when it gets off, you feel very out of your body. It's almost like an outer body experience. You don't know what's going on with you, and you may be putting on weight or losing weight. So there's a hypothyroidism and there's a hyper, okay? So hypo is where you would be putting on a lot of weight, your hands are cold, you feel tired all the time, you just don't feel yourself. And then hyper is where you may be losing rapid amounts of weight, you your heart rate is beating out of your chest like I explained, and you just are noticing things that your body wasn't doing before. So that is why we have two different categories, and what actually controls your thyroid gland is your T3, T4, and your TSH levels. So that's why I had you get your blood work done so that they can kind of check to see how those levels look, and that is how we can tell if your thyroid gland is off, okay? Yes. Yeah. So, is there anybody in your family that has thyroid issues that you know of? Okay. No, that's fine. It's hard to know what your family has medically going on, medical history. But sometimes thyroid issues run in your family, so it can be a hereditary issue. Or if you don't have a healthy diet and you don't take very good care of yourself, that can cause thyroid issues. And then also, if you undereat, that can also cause, or overeat, that can also cause thyroid issues because your hormones get thrown off when you aren't eating enough. So your body is trying to protect itself, and it holds on to all the calories, everything that you are consuming, and it throws off your hormones. Yes, so that is normally the reason why you may start realizing you are having thyroid issues. There are other reasons, but those are the main ones. Okay. So I'm gonna go actually check and see if your blood results are in, so then we can know what to do from here, okay? Okay, just Just bear with me for 1 minute, okay? Thanks. Okay, so I got your test results back. And like I was saying a minute ago, your TSH, your T3, and your T4 is what we check. And I did get all 3 of them checked just to make sure that we were checking all the boxes and really getting down to what's happening, okay? So the results came back that your T3 and T4 are a little high for your TSH levels, and when your T3 and T4 are a little high, that will throw that number up, okay? So what I'm going to do, since it's not too high, we can actually put you on the lowest dosage of medicine, and that will be at 25 milligrams. And I'm going to put you on something called levothyroxine. This is a hormone pill to help regulate your thyroid gland. So this will help you start feeling better and feeling yourself again. And it will just get your hormones back on track so that you can get everything back to the way that it was, because I know it's not fun feeling this way. So I'm going to put you on 25 milligrams, and I'm going to write the prescription, and you're going to just take 1 of those a day before you eat breakfast. So you need to be taking this on an empty stomach, okay? Because it really needs to absorb into your body so that you can get the full benefits of each pill. And I'm going to prescribe you a 90-day supply, so for 3 months. And once you are out of the 3 months, I do want you to come back, because I want to redo your blood again and see where we are and see if that 25 milligrams is helping regulate your thyroid. And if it is, then I will just keep you on that same amount and we don't have to bump it up or anything. But the thyroid gland is very hard to get correct when it comes to the dosage of medicine when you first get diagnosed. So that is why I'm just going to have you come in every 3 months until we get it regulated, so that we make sure we have you on the right dosage, okay? Yeah, no, it's nothing to be worried about. There's actually a lot of people who have thyroid issues and don't even realize it. So I'm glad that you came in with having all these different symptoms that you weren't aware of and have never really felt before. So I'm just going to write out this prescription for you. And is the same pharmacy good? Yes? Okay. Perfect. And also, to kind of help with this process, if you are not eating correctly and you're not drinking enough water, I would really recommend you start doing that if you really want this to get under control, okay? Yes. And then if you can, try to start working out a few days a week. It doesn't have to be anything strenuous, but just get your body moving for me. Yes. That'll really help. All right, my dear, well, thank you for coming in, and if you have any questions or concerns, don't hesitate to give me a call. Yes, I will leave my phone number on here so that you can reach me at any time. Yes, absolutely. I hope you start feeling better. Have a great day, okay? Bye.